Records are being broken in the United Kingdom, with the daily number of confirmed cases of coronavirus topping 93,000 yesterday. Encouragingly, there's also been a record surge in the number of booster shots being administered, and for now, the health and hospital system isn't being overwhelmed.
The experience in the UK could offer some insight into what's in store for Australia in the coming days and weeks. Dr. AJ Verma is a hospital consultant and physician based in the UK, and he joins us now. Thanks for being with us. We're really focused on the hospitals. We're trying to focus less and less on case numbers, although it is difficult when they're surging. Can you give us an insight into how the health and hospital system is coping there at this time, although it is somewhat early days?
Good morning, David. I was thinking about this as I was driving into work, and I thought the best way to look at this is a bit like being an English cricket fan at the moment and slowly, nervously watching what happens day by day. As you're right, the kind of case numbers are surging, and these are the highest figures we've seen throughout the pandemic, yet you are correct that the hospital system is holding out. During the peak in January, where we had a massive surge at that time, hospitalizations hit 40,000, and we're at 7,000 patients at the moment. So we're nowhere near as bad as it was earlier in the year, but we're very nervously looking on as the cases surge through.
How prepared are the hospitals for a potential new surge, and particularly the staff that work in them that must just be exhausted after the last couple of years?
Yeah, you've hit the nail on the head there. We are quite tired. There's the fatigue of how busy we are generally, and then the fatigue of having another surge and another lot of restrictions and the fear of another difficult winter. We're doing the preparations as best we can, and I think having had the experiences of surges before, that will make us prepared. But we'll honestly just have to wait and see how it goes over the next few weeks.
So the UK is once again a little bit ahead of Australia in terms of the rising number of Omicron cases. It started with a much higher baseline than Australia, and the vaccination rates aren't exactly the same, but both countries have relatively high vaccination rates. I suppose we look to the UK as something of a window into our future here in Australia. What would you like to tell Australians about what's to come and what to expect and what we should do?
I mean, our saviour from the hospitalisations that we saw early in the year is the vaccination programme. In the UK, we've got 82% of our population have had 2 vaccines, and we're pushing really, really hard for the booster dose. That's being pushed out very, very hard, and there's lots of media campaign about this. And that's what I'd urge, our kind of Australian friends as well, make sure that you are vaccinated. There's lots of myths about vaccination, but it's by far the safest, weapon we have against COVID. It is, the risks are far outweighed by the benefits, and I would urge everybody who is eligible to get a vaccination as soon as possible to protect themselves and their community.
In the UK, boosters can be administered after just 3 months. In Australia, it's at 5 months. It was at 6 months until a week ago. But our sort of medical agencies are resisting reducing that time at this point. What would you say in relation to that? Do you believe boosters should be administered earlier than 5 months after a second dose?
My understanding is that there is some concern about the protection offered by 2 doses of the vaccine to the Omicron variant. And the kind of up-to-date studies or the analysis we have, the best view we have is that the booster gives additional protection. So absolutely, I think we've had to be very pragmatic here in the UK to shorten that interval, because we know that this Omicron surge is the numbers are scary. And as well as hospitalisation, worry about things like long COVID as well. So I think in Australia, they may end up having to shorten that interval if cases start to rise.
How are the average Brits handling this latest surge? There's been less compliance, I think, in the last few months to the few number of restrictions that still remain. But are people worried? Are people taking it into their own hands from what you can see and sort of removing themselves, socially distancing, wearing masks and the like?
It's very interesting. Today, I actually had a day off after a period of being on call and took my family into London and saw huge queues outside the vaccination centres for people dropping in, walking for their vaccines, which was the booster, which is a very, very good sign. On the train down into London, the majority were wearing masks. So I think people have taken it on board. The kind of appetite for restrictions is low, though, and obviously the political side of things, it makes it very difficult. Our current government are facing a bit of a battle, having had lots of revelations in the last few weeks about certain political parties, last Christmas, which were in breach of lockdown then. They've all been leaked to the press in the last week, and the government has suffered a big by-election defeat yesterday. So, the restrictions is going to be a very interesting prospect. It is the ultimate tool that we have to slow things down. And I do think there may have to be restrictions if the case numbers continue to rise so rapidly. But whether that will not happen is difficult to know.
Yeah, because
as it stands today, the majority are kind of taking it on board, I think.
Yeah, I note that Denmark has imposed new restrictions, is closing a bunch of venues as cases rise there. There's no, as you say, or at least very little appetite for closures, for lockdowns and the like in the UK. Would it have to be a last resort? Would we have to be seeing ICU units overwhelmed and the like before that happens?
Yeah, I think so. I mean, there's always two sides to the coin. We're trying to protect our health service and the kind of capacity to make sure we're not overwhelmed, but is the other harms from lockdowns in terms of the economical damage and the kind of harm to school kids when they were away from school. So it is trying to balance that out. And I think, the government are very clear in saying that there won't be another lockdown, but there may become a tipping point where they have to. I don't envy anybody who has to make that decision anywhere around the world, because there are so many factors to weigh up. And the longer this pandemic goes, the harder it is to balance things out.
Yeah, that's very true indeed. Dr. AJ Verma, thanks so much for joining us from Kettering in the UK.
Take care.